Hey everybody, Paul Singh here describing a Hydrus Microshunt surgery in his left eye, making my small paracentesis superior temporally to gain access to the nasal angle. Now what's nice about the Hydrus is you can actually turn this wheel on the front part of the loader to adjust the orientation of your cannula tip to better suit your hand position and your orientation. So now I have the gonio prism on the eye. I can see a beautiful view of the angle structure. It's really the most important part of any of these MIGS procedures, getting that good view. Now entering through my paracentesis here with my Hydrus loader. And now again, I'm going to make sure I have a good view. I'm going to stop for a second, make sure my focus is still clear. And now once I feel good about my focus, I'm going to go ahead and engage the trabecular meshwork, 45-degree angle towards it, and then 15-degree angle up. And see the little white dot? That means I'm now in the Schlemm's canal. Advance the wheel, and I'm releasing the Hydrus Microshunt into Schlemm's canal with those windows, scaffolding the Schlemm's canal. And now as a clamshell opens up, I'm going to take my loader and just nudge it slightly towards the Schlemm's canal, so about half of the inlet's in the anterior chamber and half of it is within Schlemm's canal. It's that straightforward. I mean, this is one of the most straightforward shunts or any procedures I do in the MIGS space. Not a lot of hand manipulation, not a lot of in and out of the eye. And although it's a longer shunt, most of it resides within the Schlemm's canal. So it's a really efficient surgery, I think, from my perspective. Now, as I'm hydrating the wounds and injecting BSS in the anterior chamber, you see a beautiful blanching in the nasal superior in a view here nasally. Now, this is slow-mo as I inject BSS in the anterior chamber. Just look at the blanching between those two arrows, just like a whiteout. And again, this is nasal and inferior nasal quadrants here where the actual shunt is positioned. So in the distribution of the shunt, we're accessing those collector systems here, scaffolding Schlemm's canal, bypassing TM, and having access again to those distal collector system. Now, just making sure the wounds are watertight here, just removing some viscoelastic from the cornea there and the conjunctiva, and just showing you again how beautifully blanched this nasal quadrant is. To me, it's like eye candy. I love this stuff. I hope this helped you. Again, it's a wonderful stent for a lot of those patients who need it. Take care and hope this helped.